Hello, my name is Katie Timms and I am the Colorectal Cancer Lead Nurse Specialist at Chesterfield Royal Hospital. I work as part of the colorectal team that consists of 2 other specialist nurses, a cancer support worker and 2 staff nurses supported by a secretary. We work very closely together to provide support, advice and information to anyone diagnosed with cancer of the colon, rectum and any other inflammatory bowel conditions, including stoma formation. This involves all stages from diagnosis, investigations, treatment and follow-up to help patients understand their care pathway and to coordinate involvement with other specialities. The cancer nurse specialists play a vital role to help patients adjust and adapt to life in the weeks, months and years after treatment. We are there for patients, their carers, family and hospital staff, either face-to-face or over the phone. We are an integral part of the colorectal multidisciplinary team and we are essential in the patient's journey, ensuring that everyone is treated with care and compassion.
Hello, my name is Ria Rosser. I'm a colorectal consultant at Chesterfield Royal Hospital and I will tell you a bit about what happens when a GP refers a patient for a colorectal appointment. It's important not to worry. Symptoms such as bleeding, change in bowel habit can have an innocent explanation, but to be thorough, we prefer to rule out more serious causes such as inflammatory bowel disease or cancer. A consultant will review the referral and an appointment will be made based on what he or she feels is most suitable for you. You may receive a telephone or video consultation where you will be asked detailed questions about your symptoms and general health. We will explain which investigations you need and a further appointment will be made. If we feel it's clinically appropriate or you need a physical examination, you may be invited for a face-to-face consultation.
Hello, my name is Lisa Seravina and I'm the lead CT and MRI radiographer at Chesterfield Royal Hospital. In the CT and MRI department, you will meet experienced senior radiographers and imaging assistants who will support you during your scans. They understand that this can be an anxious time for you. CT and MRI scanners have a similar shape but work in different ways. CT is commonly described as looking like a polo mint and MRI is longer, noisier and open at both ends. Both scans involve completing a safety questionnaire beforehand. An MRI is a superconductive magnet, so questions will be asked about recent and past surgeries, injuries to your eyes involving metal fragments, and any other implants or electronic devices. CT involves X-rays and is likely to require an injection of contrast, sometimes referred to as a dye, via a cannula to highlight your blood vessels and other structures. You may be asked to get a blood test prior to your scan depending on risk factors such as age and diabetes. You may also need contrast when having an MRI scan. We therefore require the same information via a blood test to assess your kidney function. The scan you will have will be determined by the questions your doctor has asked when referring you. If you require any additional preparation, you will either be told when your appointment has been made on the telephone or through a letter and information sheet sent through the post. If you've had an injection of contrast during your scan, we will need you to stay in the department for 30 minutes after the time it was given. Once this time is up and you are feeling okay, we will remove the cannula and you'll be free to go. Your scans will be reported by one of our radiologists and the results will be passed on to you by the referring doctor.
Generally speaking, the majority of our patients have an endoscopy, a camera test via the back passage. Depending on the symptoms, this may be a limited camera test called a flexible sigmoidoscopy to examine the left half of the colon. This requires an enema preparation. A full camera test called a colonoscopy examines the whole colon and requires an oral bowel preparation the day before. The bowel preparation is posted out to you with detailed instructions of how and when to take it. If you are unsure about anything, there's a telephone number on the information leaflet that you can call. If you have a camera test, we will be able to tell you quite a bit about your condition. Very often we see a normal bowel, but we might take samples for a closer look under the microscope to make sure there's no colitis, which is inflammation or irritation of the cells lining the bowel. If something more serious is present, such as a lesion that has the potential to be cancerous, we would take a biopsy sample and mark it. so that we can identify the area again later. We would let you know at the same time of the camera test if we are worried about a lesion. At this stage, we will put you in contact with the specialist nurse team and understand that you may have a number of questions. Some questions may not occur to you until you have left the hospital, but don't worry, our specialist nurse team will give you a contact number so that you can call them and discuss any questions whenever they come to mind. Tissue samples typically take 7 to 10 days to be analysed. If a cancer is discovered, you will be supported throughout the next steps. And this could involve further scans such as CT, MRI or a full body MOT to assess the best treatment for you, whether it's radiotherapy, chemotherapy or a combination, surgery or symptom management. Each patient is discussed weekly with specialists to tailor each treatment according to the individual. You will be fully involved in the decision making to get the best and right treatment for you. If an operation is recommended for you, there is a good chance it will be performed by keyhole or laparoscopic surgery. Your surgeon and specialist nurse will explain the operation in detail with you with pictures and diagrams and what to expect after surgery. Following your operation, you will be cared for in a high dependency area for the first few days. And once you show signs of recovery, are mobile and the pain is well controlled, it will be time to think about discharging you home. And for some people, this could be early as day 3, but on average, our patients stay in hospital for about 7 days. Your care will continue after discharge. For example, if you are worried or things don't seem right, our colorectal team can be contacted over the phone. You will also be seen in the outpatient department to make sure you are making a good recovery. If we feel that you would benefit from chemotherapy after surgery, you'll be invited to see our oncology team. This could be at Weston Park in Sheffield or at the NGS Macmillan Centre at Chesterfield Royal Hospital. For some patients, the best course of action is the management of symptoms. In this case, we ask other specialists to help support you and manage your needs. All patients are different and their management differs, but we're here to support patients no matter what their diagnosis and needs might be.
Hello, my name is Claire Warburton. I'm a Macmillan Information and Support Associate. The Centre offers advice and information to anyone affected by cancer, including colorectal patients. If you are already in the hospital for an appointment, you can drop into the centre to meet with staff who will find the information and support you need. You can also call or email the centre should you have any queries that arise. Our services are available to anyone in North Derbyshire.
Patient experience is extremely important from their diagnosis through surgery and into follow-up care. One of us will be allocated as the patient's key worker, acting as their advocate to support and answer any questions or concerns, liaising with their GP and community teams. Awaiting results and undergoing investigations can be a very anxious and difficult time, so we always encourage patients to contact the colorectal team for support and advice. We use a holistic needs assessment tool to understand what support a patient needs. It's a simple questionnaire that helps us to identify and talk about any worries, fears or financial concerns the patient may have, and to develop a personalised care and support plan. We also help to manage any symptoms and identify healthcare needs that fall outside of a cancer diagnosis. Through this assessment, we can also assist with reducing anxiety levels, helping the patient feel more understood no matter what they are going through. This ensures our patients' physical, emotional, practical, spiritual and social needs are appropriately met at different times throughout their cancer journey. I hope you find this video useful and thank you for watching.